Good evening, all. Welcome to today's session of CBME Physiology series. Today we have a two topic: alignment and integration, as well as feedback. So initially, alignment and integration will be taken by Dr. Subhada Gade, madam, and feedback will be taken by Dr. Hasmukh Shah. So we will wait for others to come for 2-3 minutes only. We will start by 8:05. So if anybody has any query, just write in the WhatsApp or write in the chat box. So we can discuss it for 2-3 minutes, and then we will start today's session. On board we have a Dr. Mathangi and Dr. Swapnil also. So we can get answer of any of your questions. So anybody is having any questions, please write in the chat box, or you can write in the WhatsApp. Yes, so we are getting few queries in the. Okay. So few people are asking regarding today's ID. Let me put in the WhatsApp. Thank you, Dr. Yogesh. You are always there to help others.
Yes.
Thank you very, very much. You are an asset to our group. Dr. V. Veluswamy. Sir, I don't know, sir is madam, but we have one full session on logbook and certification. So we will be taking logbook and certification of skill on that session. So it's 8:05. Let's start our today's session. So I think there is no need of much introduction. Subhada Gade madam is at Nagpur, and madam is an editor of two journal, and madam is head of the department in Department of Physiology. Madam, over to you.
Okay. Thank you so much, Chinmay. Good evening, all. And I hope everybody is keeping up with the job of forming SLOs. You must be designing well constructed SLOs. Okay. And in order to help you in that, let us go ahead. And today, let us have a session on alignment and integration. Actually, we are having two sessions today. The first 25 minutes we will devote to alignment and integration, and second 25 minutes, later half of the session will be devoted to feedback, a very important session for all of us. Okay, so we are beginning with alignment and integration. And now, as I think most of us have heard the term integration. Okay, alignment is little bit a new term for us, but integration, yes, I think most of us know the word integration. Okay, now from where this word alignment and integration has come, and why we are discussing or why we are having this session. Okay, so the learning objectives of my session are to understand these terms, every one of you must understand the term what is meant by alignment and what is meant by integration. Now there are three types of integration which are new to us. So we have to understand these three types of integration, and all of you should be able to facilitate the development of an aligned and integrated curriculum in your own institution as it is envisaged in the JEE Mark 2019 document of MCI. So these are the learning objectives of today's session. Let us see how far we can achieve them. We want to achieve them rather. Okay. So the new terminologies that we'll be discussing in this session is, first of all, this term alignment, second is integration, and third is linker. All these three terms are a little bit new for us. Integration, though we have heard, but today we are going to discuss alignment under three different headings which most of you have never heard of. Okay, and if you can see, this integration has been further subdivided into three types: sharing, nesting, and correlation. So integration is of these three types as far as the new concept of competency-based medical education as envisaged by Medical Council of India. Up till now, we were knowing integration by only two ways, either horizontal integration or vertical integration. Now these three new terms have been introduced, so we are required to learn these three terms. Okay. As far as the history of medical curriculum goes, all of us, we know that till 1999, the teaching of medical curriculum was absolutely subject based or discipline based. No one subject was knowing what is happening in the other department or what the other subject is doing, what they are teaching, how they are teaching. We were totally working in isolation. Then in 1999, MCI came out with a JEE mark in which they introduced a concept of problem-based learning and integrated teaching concept. They introduced this concept in 1999, but they didn't make it mandatory. And we know that the Indian mentality is, as long as the things are not made mandatory or compulsory, we don't do it. Okay. So even then when it was introduced in 1999, very few colleges and very few intrinsically motivated faculty, we can say, they try to incorporate this integrated teaching concept, but in a sporadic manner. So that was the story from 1999 till 2019. And the new GAMR of Medical Council of India, which came out in 2019, which were designed by an expert group, they thought on this curriculum and they came out with a new concept of alignment and integration, taking into consideration these two things. They want to preserve the wholesomeness of the medical education so that the patient as a whole should be treated. Everything should not be too much integrated. So wholesomeness of the medical education should be kept intact, and we have to preserve the inherent strength and flavor of the subject-based curriculum. We cannot go for everything alignment and everything has to be integrated. So by keeping these two objectives in mind, okay, MCI expert group in 2019, they introduced this CBME and they came out with the concept of alignment and integration, but in a new way, in a new format. Now, what is this new format? Let us see these terms. The first is alignment and integration. Now, what is alignment? Alignment is to align related subject matter in a temporally coordinated fashion. It means, in simple words, this is mean that similar topics or similar systems will be taught by different departments but at the same time frame. Okay, so different departments are teaching similar systems at the same time. Okay, that is what is called as alignment. And integration is what? Integration is sharing similar concepts from multiple subjects. Okay, and they are merged into a single teaching session, and the purpose of this integration is to remove redundancy and overlapping. Okay, now I will clear all these terms by giving you suitable examples from our own subject. But now we know that there are number of areas, number of concepts, number of learning objectives which are common to multiple departments. Okay, and they teach the same thing in the different departments are teaching same thing at the different time frame. Now what this causes overlapping of the subject material, and it causes, because of that, it causes redundancy. So can we remove that? Yes, we can remove that. How we can remove that? By integrating the similar concepts. Okay, and to integrate the similar concepts, MCI has given us three terms: sharing, nesting, and correlation. Okay, let us see what is meant by these three terms, beginning with alignment. Alignment, as I told you, it is the teaching of the subject material of a particular organ, one organ or one system from the same phase at the same time frame temporally. Temporally means at the same time frame. Okay. So a good example that of this can be, suppose we are teaching, say if we take an example of organ, okay, so, say example of liver or thyroid gland, anything. Now this is an organ or gland which is taught by all the three departments simultaneously, not simultaneously, at different time frame by the first three departments of the first year. Anatomy people also teach liver, physiology people also teach liver, and biochemistry people will also teach liver function test. Okay. Now, if the liver is taught by these three departments simultaneously in the same week or on the same day, that then it becomes alignment. Okay, so this is an example of organ alignment. If I want to give you an example of alignment of a system, a classical example of alignment of system is, suppose like we are teaching respiratory system in physiology, and at the same time, if the anatomy people, they start dissection of the thorax, and students are actually dissecting pleura, they are learning vertebra and ribs and intercostal muscles in the demonstrations of anatomy people, that will make teaching of the respiratory system in an aligned manner. Means both the anatomy department and physiology department, they are teaching same system simultaneously, but their learning objectives are different, but they are teaching them at the same time. Okay, so got it? So this is what is called as alignment. And how much should be alignment? MCI has very clearly said that try to cover your curriculum more than 80% by alignment. See how, what is the expectation of MCI from us? They say that 80% of the your curriculum, try to make it align. Similar subject, similar system should be taught by different departments, but at the same time frame. Okay, so it should be 80%. But when you I hope most of you have designed your academic calendar for 2019 batch in the last year, and you must have experienced that it is not possible. It's very difficult to achieve this 80% of the alignment. I will share my one of your experience with me. Okay, second part is integration. So alignment kitna karna hai? 80%. Integration, naturally, how much proportion will remain for integration? MCI says that integration should, you do integration, but it should not exceed 20%. It, out of your total syllabus, only 20% of the topics or 20% of the systems should be taught in an integrated manner. So alignment 80%, integration 80%. Now how this integration can be done? Integration implies that the common concepts in a topic or organ or systems which are similar, which are overlapping, because of which they are become redundant in nature, they can be merged into a single teaching session in which subject based demarcations are removed. We will discuss this with example. Now how this can be done? Integration can, now we know these terms, just I am taking back to our previous concept of integrated teaching. We used to do integration in a horizontal manner and in a vertical manner. Horizontal manner means teaching similar subjects across disciplines in the given phase, in the similar phase. That is horizontal integration. Vertical integration is teaching something across different phases of the course. Means teaching of one subject by department of physiology, pharmacology and medicine. That is called as vertical integration. And teaching of a common topic or an organ by three departments, anatomy, physiology, biochemistry, of the similar phase, phase 1. That is called as horizontal teaching. So this is how we were doing integration up till now, in a horizontal way and in the vertical way. So this is how we can do it, and how much we can do it? It should not be more than 20%. Okay. Now, if we look at this, 80% alignment hona chahiye, 20% integration hona chahiye, but is it possible that all the topics in our curriculum can be taught in an aligned and integrated manner? No, not possible. There will be many topics which cannot be aligned or which cannot be integrated. So what to do with this kind of topics? We have to keep a separate slot in the timetable for these topics, and we have to mention it in our academic calendar. If this is a list of topics which they cannot be aligned, they cannot be integrated with any other subject or discipline. So this is what alignment and integration is all about. Now, when we do alignment and integration, rather when we are designing this aligned and integrated curriculum, we have to take precautions. We have to take care of certain things. So I want you to note that in integration, it is not essential for 2 or multiple teachers to teach. Okay, suppose you are teaching a common topic, say liver. It is not required that one teacher from anatomy, one teacher from physiology, and one teacher from biochemistry will come together to teach this topic of liver. Okay, only one teacher will share the common learning objectives and they will teach that topic of liver to the students. So this will remove the repetition, overlapping, and redundancy. Okay, but multiple teachers from different phases and different subjects are required. What for they are required? They are required in lesson planning. So they should be involved in lesson planning, but not in the delivery unless it is absolutely necessary. Absolutely necessary ke examples can be, suppose we want to teach them audiometry when we are teaching them deafness. Okay, audiometry ke liye it is better, always better if a ENT person can come and teach audiometry. It is always better. So they say that MCI says that don't involve too many teachers even if you are designing alignment or integrated curriculum, but involve the teachers in lesson planning but not in the delivery unless it is absolutely necessary. What is most important? Most important is that the session should be planned in such a way that objectives of both the subjects are achieved. ये नहीं होना चाहिए कि फिजियोलॉजी वाला टीचर पढ़ा रहे तो he will give more emphasis on physiology part and he will neglect the biochemistry part. That should not be done. So these are certain precautions which we have to take when we design aligned and integrated curriculum. Then this was a new term which we heard, linker. I introduced this term in the very first, second or third slide. This is a new terminology, linker. Now the term itself is quite self-explanatory. What is linker? Linker must be something which links the different departments, which links the teaching in the different department. So linker is a session that allows the learner to link the concepts from different subjects which are presented in the aligned and integrated curriculum. अब क्या हो सकता है linker? Naturally, a linker can be a patient or linker can be a paper-based case. So linker is generally a case which will combine, which will link the learning objectives of the multiple departments. Okay, and this is required in one type of integrated teaching. Now MCI says that, MCI in his booklet has mentioned that a case which is creatively, beautifully designed, creatively written, can be used in each phase. In each phase, I am saying often the same case. A case which is designed, beautifully designed by involving multiple teachers, the same case can be used in each phase, and it will allow the students to correlate their learnings in understanding the disease process and its management. Means suppose we have designed a case of, say, a beautiful case of a multinodular goiter having thyrotoxicosis, having signs and symptoms of thyrotoxicosis. Okay, now this type of case will be a linker. Which departments it will link? It can link the learning objectives of anatomy department, it can link the learning objectives of physiology department. Even the same case can incorporate the learning objectives of surgery, learning objectives of medicine departments. So what they say, MCI says that they have mentioned that use the same case which the students are studying from phase 1 to phase 4. Okay, so every time they will be visiting the same case, and their concepts which are involved in that case will make it clear the learning objectives of different departments at different time frames. So that is what linker is, a patient or a case. Now, when we are designing an aligned or integrated curriculum, naturally, when we incorporate anything new, assessment has to be linked with that. Okay, so how to do assessment of alignment and integrated curriculum? Now MCI says that even though you are doing alignment, even though you are doing you are teaching in an integrated manner, still the assessment remains subject based. Okay, so assessment will be done by the respective department or respective discipline or subject. But if you are planning a module, say respiratory system, okay, if you have aligned respiratory system with anatomy department and you have come out with a module which will run there for say period of 6 weeks, then one can have a combined formative assessment at the end of the 6th week or at the end of this module. But naturally it will be a formative assessment, it cannot be an internal assessment. Okay, so this is what assessment is all about in an integrated and aligned curriculum. Okay, now these are certain figures which I have picked up from the MCI website and MCI booklet. Okay, to clear up our concepts about alignment and integration. Have a look at these figures clearly. Okay, now the first figure where alignment is written, now this alignment means temporal coordination. What is temporal coordination? Same topic being taught by different departments at the same time. That is called as temporal coordination. So these four different bars of different colors, as you can see. So you imagine that these are four departments. These four departments are teaching one common topic simultaneously. A classical example I can give you, say a liver or a thyroid or digestive system for that matter. Okay, so that is called as temporal coordination. Okay, now next concept is integration. Now in integration they have used three terms. Integration can be done by these three ways. First is sharing, second is correlation, and third is nesting. Now let us try to understand these terms. What is sharing? Now again, these are the four blocks, and these four blocks represent four departments. Okay. Now if you see carefully at this picture, pink and green, these are two departments. Okay. These two departments have their own learning objectives, their own curriculum. Okay. But can you see something overlapping between the two departments? Means this is the overlapped curriculum, or in today's terms we can say certain learning objectives are common to these two departments. Okay. A classical example, as I said, liver functions. Okay, liver functions are taught by biochemistry and liver functions are taught by physiology. Suppose these are physiology and biochemistry department. Okay, now we as a physiologist we are required to teach them liver functions. Biochemistry people, they have to teach them liver function test, but they cannot teach them liver function test unless and until they teach them liver functions. So they, what they do while teaching liver function test, they again discuss liver functions with them, and then they go ahead with the liver function test. So functions of liver remains common between the two departments of biochemistry and physiology. So now, so if these two departments sit together, okay, and find out that these are the common things which we are teaching, आप भी पढ़ाते हो हम भी पढ़ाते हैं, so can we come out with a learning session where only one of the two departments will teach liver functions and other department can skip that? Okay, means can the two departments share their learning objectives? Yes, they can share their learning objectives. For that they need to sit together, they have to find out which learning objectives are common to these two departments, and then one of the two departments has to take the responsibility of involving them in their teaching program. That is what is called as sharing of common learning objectives between the two departments. Same is the case with these two departments. Now this can happen in any phase. Okay, I hope I am clear. Second is correlation. Okay, now in correlation, can you see these four departments? Okay, now these four departments, the four different boxes, colored boxes are shown. So these are four different departments. Okay, now these four departments, they are teaching their curriculum in their own way. Okay, now but can you see something common between amongst the all four departments? This pink box is touching all the departments, which is demarcated with a red line, but it is connecting, it is linking all the four departments. Okay, so this is called as a linker. Okay, and what this linker can be? Linker can be a case. A case can be only thing which can link the learning objective or concepts of four departments. Okay, I'll give you one example. Okay, the same example I use everywhere because it's a very classic example. Suppose you creatively, beautifully design a case of toxic multinodular goiter. Okay, with all the signs and symptoms of thyrotoxicosis. And now this case will be used by anatomy department to teach them anatomical part of the liver. The patient is having goiter, so they can correlate them with the anatomical gross anatomy of the thyroid gland. Same case can be used by the physiology department if what has gone wrong with the thyroid functions. When we teach thyroid functions, we can use this case, same case. We will use the same case to teach them what goes wrong in thyrotoxicosis and how the thyroid functions are deranged in thyrotoxicosis. Same case can be used by biochemistry department to teach them how the thyroid function test will be altered when they are teaching normal thyroid function test, how the thyroid function test will be altered in this particular case. So they have, we are actually doing this, so they are covering the applied aspect. And let me tell you, the same case of goiter can be used by the surgery departments when the same students will go to final year. Okay, same. Now here only 4 departments are shown, but the same case can be used by pharmacology department to teach them anti-thyroid drugs. Okay, so that is what correlation is. Correlation is a case, a linker has to be used in correlation, and linker will link the concepts of the 4 departments. The beautiful part in this is a case has to be designed very creatively, and preferably I am saying the same case should be used across all the phases by different departments, because students are familiar with the case. They have discussed this case in first year, they have discussed this case in the second year, and now they are coming to third year. So students will understand how to link the concepts of different departments with the help of a case. So that is what correlation is. And the third type of integration is nesting. Nesting is, this is the diagram is very self-explanatory. Again, the 4 departments are there. 4 colored boxes means 4 departments. Now suppose this is a peach color department, so say this is physiology department. Okay, now in this big peach color box, a small blue color box you can see. Blue color represent this department. Okay, now say suppose this is medicine department. Okay, so क्या मतलब हुआ इसका? The department of physiology is teaching something, is using some learning objectives of medicine department to incorporate in their teaching session. I will give you an example. Okay, nesting means suppose I am teaching or any physiology teacher is teaching coronary circulation to the students. Okay, so we are taking a class of coronary circulation, and while taking a class on coronary circulation, suppose I used a video to teach them how angiography is done to detect the suppose you are teaching myocardial infarction. So how angiography is used, a video of angiography or findings of angiography, if I incorporate in my session, say last 5 minutes or 10 minutes of my lecture, if I devote it to this, okay, is it my job to teach them angiography? No. किसका काम है ये? Medicine department का काम है. But I have incorporated these medicine department का learning objectives in my class. So I have nested a small part of medicine teaching of the medicine department in my class. Okay, this is what is called as nesting. So nesting is same thing. I am sharing a learning objectives of medicine department, but if you have understood sharing and difference between sharing and nesting, nesting is sharing of the learning objectives of other department from a different phase. Okay, sharing is sharing the learning objectives of the departments in the same phase. Nesting is sharing the learning objectives of the department from a different phase. Now this different department, I have told you this is medicine, this can be pharmacology also, this can be pathology also. So I am just mentioning few learning objectives of different some other department, but from a different phase. That is called as nesting. I hope I am clear. So sharing is sharing learning objectives from the same phase. Correlation, a linker has to be used. A linker will link the different concepts or different learning objectives of different department from different phases. And nesting is sharing of learning objectives from subjects of different phases. Okay, so this is what integration is all about, and that is why I said up till now integration means only 2 terms we were using, either it was horizontal or vertical, but now MCI has come out with this 3 terms: sharing, correlation, and nesting. Okay, so same thing which I have explained you with the example. Now regulations, what do the regulations, GMR regulations say? GME regulations say that 80% of your curriculum should be needs to be aligned. Okay, so how alignment has to be done? That is our job. MCI has just said that these are your competencies. Now you see to it that 80% of your competencies should be in the aligned fashion. So alignment, how much should be done? Alignment should be 80%. What is alignment? Same definition. Alignment could be done as an organ, as a system. It can be organ based, it can be system based. I have given you example. And for physiology people, for first year, the classical examples which I often use is the exam alignment ke liye the best examples are teaching of respiratory system, cardiovascular system with the dissection of thorax in anatomy, and teaching of GIT, kidney, and endocrines simultaneously by anatomy, physiology, and we can also involve biochemistry here. So that can be the good examples of alignment for us. Okay, now here I want to share, I will just take 2 minutes, I want to share one important experience of mine. Dr. Pandey, Sushma Pandey madam is also here, she also knows. Now, I'm a member of Board of Studies of Maharashtra University of Health Sciences, and Sushma Pandey Madam is the chairman of Board of Studies of Preclinical Studies in MEUHS. Okay. Now, when the MCI introduced this competency-based medical education, they came out with the competency table and they gave it to the universities. Okay, now you see how it is to be implemented. For that, MEUHS called us a meeting of Board of Studies, and they also formed a task force in the state involving multiple teachers from multiple colleges from all areas of Maharashtra. So we all of us, we went to Nashik. We brainstormed there for 2 days. For 2 days, we have multiple meetings, and the multiple meetings were done what for? Ki alignment, how to do 80% of our curriculum, how to align it. That was not possible. Up till now, please remember, from our school student life till today, have we ever seen that all these systems were taught to us simultaneously by anatomy, physiology, and biochemistry? No, because everybody has a strict rigid pattern and the ego. Okay, so अब इनको अगर respiratory system, cardiovascular system को एक साथ पढ़ाना है by anatomy and physiology people, what is required is, now see, traditionally, conventionally, right from when the first medical college started till 2019, the sequence of dissection in anatomy is, they start with supex, then they teach infex, then they do head neck face, and in the last part of the year, they do dissection of the thorax and abdomen. Whereas for physiology people, we start with blood, general physiology, muscle now physiology in the first month, and in the second month itself, we begin respiratory system and cardiovascular system. So agar inko, if we want to align them with the anatomy, then anatomy people are required to change the sequence of their dissection. Okay, now here comes the role of a rigid mindset जो हम बोलते हैं. Okay, anatomy people said no, since ages we are doing the dissection in this fashion, how can we change the sequence? We said, this is our sequence, we cannot change our sequence. Who can change? Anatomy people. So for 2 days, we had marathon meetings. We discussed meetings after meetings. We discussed for hours together. And let me tell you, this is a very, what should I say, a good development in the at least in the state of Maharashtra. At last, at the end of second day, the anatomy people agreed that for the first time, they have changed the sequence of dissection. After supex, they started dissection of thorax, where and at the same time, we physiology people, we taught them respiratory system and cardiovascular system. You imagine the beauty of teaching here. The students are learning intercostal muscle, ribs ke movement, ribs ka anatomy, vertebra ke anatomy, and we are teaching them mechanics of respiration. How easy it is for the students to understand and to assimilate this knowledge. Similarly, if they are doing dissection, dissection of abdomen, students are actually visualizing the GI, the different organs in the GIT, kidney, and we are teaching them GIT, digestive system, or kidney, or endocrine, and simultaneously biochemistry people are teaching them the different function tests. How beautiful concept it is. So this has happened in Maharashtra. Sushma Pandey Madam is a witness to this, and she's the president, she's the chairman of this. So a lot of credit goes to her for doing this alignment, at least in Maharashtra. Okay, so this is all about alignment. I just shared my experience. Okay, and agar hum alignment karte hain, so how this will look like in the timetable of any college. Okay, can you see this green is cardiovascular system, and if you see, we are not studying this chart in detail, it's quite complicated. It will take a lot of time. What I just want to see is, see the physiology, biochemistry, anatomy, all the people are teaching cardiovascular system simultaneously. Okay, in their timetable you can see that cardiovascular system is being taught by all these departments simultaneously. And if you see carefully, you see this anatomy people at the same time, they have nested one session with radiology. Okay, they must have shown x-rays chest to the student while discussing cardiovascular system, and in physiology and biochemistry ने भी कुछ shared session कर लिया इसमें. So this is a combined timetable of alignment and integration. And the similarly नीचे वाला जो है, this is pink is respiratory system, again being taught by different departments together, and along with alignment they have also done integration and by sharing and by nesting. Red is nesting and blue is sharing. Okay, so this is how it will look like in the timetable. Now suppose, I hope we have understood these terms. Now suppose we want to plan this. How to plan sharing? शेयरिंग के लिए क्या करना पड़ेगा? टू डिसिप्लिन्स और टू डिपार्टमेंट्स मस्ट एग्री टू प्लान एंड जॉइंटली इम्प्लीमेंट अ टीचिंग प्रोग्राम. For that, they have to share their common learning objectives. But I told you, responsibility has to be taken by one department. Okay. And what can be the examples of sharing? At least in physiology, in first year, these are the examples. Hemoglobin metabolism being taught by physiology and biochemistry. And I, for your understanding, I have taken this competency also. In physiology, the same thing is included in the competency 2.3 and 2.5. Biochemistry mein same competency is mentioned in 6.11 and 6.2. So can these two departments sit together and find out if we will not do overlapping and only one of the two departments will teach them? We can share muscular dystrophy with anatomy. We can share genetic disorders with embryology. Nesting, I told you, integration in different phases. I gave you examples also. Few more examples of integration is while teaching anemia, if I touch a topic anti-anemic drugs. So I am nesting with whom? I am nesting with pharmacology department. Management of sickle cell anemia and thalassemia. I am nesting with whom? I am nesting with medicine department. While teaching kidney function test, if I touch artificial kidney or dialysis, I am nesting with medicine department. On audiometry, while teaching deafness, if I touch, then it is nesting with the department of ENT. This I have explained you. For correlation, you have to design a case and the same case will be shared by so many departments. Another example can be a case of hypertension being followed from phase 1 to phase 4 by multiple departments can be used. Assessment, I told you, it's a subject-based assessment except a module. So suppose what are the different steps if you want to design this module? Step 1 is identify the list of topics and organs or system that we know broad. Okay, yes, RS can be aligned, CVS can be aligned. Now our step 2 will be visit your CBME booklet of MCI, find out the common competency and transfer this common competency into a template. Derive common SLOs, and now by all the departments of multiple teachers of multiple departments, they will sit together and they will plan a learning session, how that session will be implemented and how it will be assessed. Step 4 will be identify the कौन सी competency को share करना है, किसको nest करना है, ये you will identify. Again, it is given in the MCI booklet. And step 5, add a linker, design a case. That is our job. Okay, we can design a case for our own college and we have to create a block in the timetable. Okay, अब इसमें से मैं बताती हूँ आपको. Step number 1, identify the list of topics and CBME booklet. CBME booklet में already the topics have been given कि these topics can be integrated vertically and these topics can be integrated vertically. ये दिया हुआ है. This is also there. We have to just find out the common competency. We can design a linker and we can accommodate all these sessions in the timetable. Okay. Then MCI has also given us a list of these common topics which can be used for integrated and aligned curriculum. Now this particular slide I have made to show you that in our competency booklet, now see, if you can see this physiology 2.2, functions of origin, forms, variation and functions of plasma protein. MCI ने खुद ही बता दिया है हमको कि this has to be done horizontal integration with whom? With biochemistry department. Different types of anemia and jaundice, हमारी 2.5 की competency can be nested now. Vertical integration कर सकते हो आप किसके साथ में? Pathology के साथ में. So it will be an example of nesting type of integrated teaching. This all when we are doing integration with in different phase, it becomes nesting. Okay. Similarly, these are certain more. So what I want to say is we need not waste our time in finding out the competencies. Only thing is it's already given in the booklet. Okay, another thing which I wanted to tell you is you have to incorporate this unit timetable and you have to show it in the academic calendar, and that academic calendar has to be displayed on the institutional website. This is, for example, we have taken our academic calendar. My college की website से उठाया मैंने. So this is, and you are required to mention which topics you have aligned, which topics you have integrated, because 80% they want alignment. Na? So see, we have mentioned in our academic calendar the topics which are aligned: general anatomy, general physiology, basic biochemistry, thorax with cardiovascular system, thorax with respiratory system. These are the departments. Abdomen, digestive system, and biochemistry people are teaching metabolism. Abdomen, dissection, excretory system in physiology, acid base balance, kidney function test by biochemistry people. Similarly, abdomen के साथ में endocrine and organ function test by biochemistry department. Okay, and the the topics which are not aligned are the non-aligned topics for all subjects. This is why I am showing you this, because this is we are required to show on your website. So to summarize, what I can say is alignment has to be 80%. You know what alignment is. Integration is 20%. There are three types of integration: sharing, nesting, and correlation. You must be able to design a linker. You have to accommodate this in your academic calendar. Whatever alignment integration you have done, it should be visible. It should be visible to all. And you have to keep a record of aligned and integrated topics in the department, because if suppose any times MCI inspection goes, they may ask you कि आपने क्या align किया, क्या integrate किया. So a proper documentation of this competency. So this is all from me. Thank you very much for this patient hearing. And with this, before we take up any sections, I hand over to Dr. Hasmukh sir. He will take us to an interesting session on physiology, and later on we will have a question answer session. Over to you, Hasmukh sir.
Thank you, madam.
Yeah.
Share your screen now.
Yes. Give me 1 minute.
And there are too many questions I can see in a WhatsApp group as well as in the chat box. So, madam, I request you to just go through the questions.
Yes.
So
I'll go
once
through.
Dr. Hasmukh sir's session is over, you can directly answer all the questions.
Am I audible, Chinmay?
Yes,
Sir.
Dr. Hasmukh. You can start.
Okay. Good evening to all of you. And I congratulate Dr. Shubha madam for the nice presentation. Really, we learned a lot from the Shubha madam as well as all our speakers, previous speakers. So my topic is role of feedback in CBME. So I think all of you are aware about what is feedback. So first of all, we'll see what is the aims of feedback. In few areas, I'll move very fast because we are running short of time. So what is the aim of feedback? So here feedback means feed and it comes to back. So here the main aim of feedback to keep medical undergraduates. So here we can add also postgraduate also. But as we are taking CBME, we can add for the physiology postgraduate also. So here to keep the medical undergraduate on the course as they arrive successfully at their predetermined destination. So here our main aim to make them medical graduate. So here this is our destination. This is our main aim. So here why we want this aim? So here we want the final medical graduate. Look here in the picture, the doctor is examining the small baby kid, and kid is really very happy. Why? Because the doctor is doing these things by her skill, attitude, and behavior. So here our main aim is to make them successful physician, to make them successful MBBS doctor. So here, so we need to give them feedback, okay? Because if the students are going unobserved and unguided, okay, they may be going toward the wrong direction. So at the end, I'll talk in the negative feedback about the wrong direction. So here to make them into the particular path or toward the forward direction, we have design. MSA has also requested us to give the feedback. So here feedback therefore is an objective description of student performance and it is intended to guide for their future performance. So look here, we are going to correct their present performance to make them perfect for their future performance. So here feedback is not small thing, okay? It is not given in one day. So here feedback is the process. So that's why it is said that it is the process, not just one step thing that we can give right now and we forget. So here this is the process and this is the continuous process. In coming slide you see the why we can say it is the process. So but we are not giving feedback. As per my experience, I have published one paper on feedback. I have taken feedback from the faculties as well as students in almost so many medical colleges of India. We are not giving feedback. So here, this is really big issue because if we are giving feedback to our students, here they are able to learn properly. Look, your feedback is must during the clinical rounds, mainly during the surgical operations as well as during the medical or clinical rounds. So here, when we are giving no time to the feedback, it means there is a no time to learn. If you are doing, look here, right now we have taken around 6 or 7 lectures, talk from how to frame the competency, how to frame the SLO, then competency table, early clinical exposure, integration and alignment. So we are doing so many things, but at the end, if you are not taking or if you are not giving the feedback properly, that means there is no learning. If students are in the misdirection, they will move toward the forward. So here, that's why there is a need to give me feedback. Now, how we can think that? So look here nowadays in traditional curriculum, teachers they are talking too much. They are talking too much, but they are not taking feedback. So here in new CBME curriculum, we have to teach less and providing them more feedback. So in this way, we will produce the greater learning. So here, teach less, provide more feedback, and in this way we have greater learning. Look here, don't misinterpret this word teaching less. Okay, we have to teach them in a proper way, and we have to complete the proper course. So here, if you are giving them the proper teaching, and if you are giving them the proper feedback, okay. So here teaching at proper time and giving them feedback at the proper time. Look here, here the doctor is teaching to their students, medical student, and maybe showing them few things and giving the feedback at the proper time. So why there is a need to give feedback? So look here, are we aware about our own progress? So many a time at student level, we are not ready to accept our mistake. So this is the main thing. This is the main aim of feedback, because self-assessment and self-realization are often inaccurate and insufficient to correct our performance associated mistakes. We are not ready to accept our mistake from student level to the higher level. So okay, we always think we are mastering subject. We are not ready to accept our mistake. So here for the correction of the mistake, we have to think. Okay, how we have to think? So here always we have to think what happened. You can think in today's lecture. Okay, what happened? And then next question, why did it happen? So if you are failing, if you are not performing any particular skill or competencies, we have to think what happened. Then again we have to think, we have to reflectly observe why did it happen. So what have I learned from this experience? You can correlate with the recording of the blood pressure. If you do not have proper readings, you can think what happened and why I have wrong reading. What have I learned? So then how to improve? What can I do to improve? So here in this way we learn. So here there is a two-way communication. There is a role of student as well as teacher. When we have any assignment or any competency submission by student, so here it will be assessed by the student, and if student is doing any mistake, we have to give them feedback. Here we can give him good as well as bad feedback. So here on the basis of your feedback, if there will be constructive feedback, so here student by own self going to reflect on your advice or this type of the feedback, student will going to modify it, and again it is going student will going to submit in a new form. So here's to feedback is mainly based on your performance, if the student is performing well or not, or as per the proper desired level of the faculty or medical teacher, feedback will be given. Feedback will be bad, good or bad, or ideally we'll give them the sandwich model of feedback. So here on the basis of performance, feedback will be given, student reflects, its own way of skill or communication, then try to correct. So here action, then final improvement. Again, it will improve the performance of the student. So here I talk about the feedback. So your feedback is the key component to achieve desired milestone in competency-based medical education. So without feedback, we are not able to learn properly. So if you are a good student and if you are going in good direction, you can learn without feedback. But if you are slow learner and if you are going in toward the wrong direction, at that time you need teacher who give you feedback. You need one guru that gives you feedback and that brought you on the right path. Because हम लोग रास्ता भूल जाते भटक जाते हैं, तो हमें सही रास्ते पे लाने के लिए feedback is needed. So now what are the attributes of the feedback? So feedback will be given on time, well timed, involves, well intended, well mannered, and well precise. So here these are the various attributes of the feedback. So first of all, well timed. So what are the keys of the effective feedback? So here keys of the effective feedback, it is specific, timely, and personalized. These are the keys of effective feedback. Now I am going to discuss the each component in detail. So here by giving the example. So your feedback will be given on proper time. So suppose you are taking the exam of your student, you have to correct his or her mistake. So first time begins from the practical lab. Suppose student is doing practical of the blood pressure measurement, and if he or she is doing some mistake, at that time you have to correct his or her mistake. Second, you can correct the mistake at the time of the assessment. But if student is doing mistake and you are not correcting the mistake at the time of the learning, at the time of that practical session. Second, at the time of exam, during formative exam. Look here, I'm talking about the formative exam. The student will not able to learn. If you are not going to correct the mistake, student is not going to learn. Student will forget these things. And if you are giving the feedback at the end, during the summative exam, that you don't know anything. So many teachers speak loudly on students and you don't know anything during the only at the summative exam at the university exam. So timely feedback, given feedback is effective to improve the future performances. We have published the paper, The Role of Immediate Personalized Feedback to First Year Medical Undergraduate during the Formative Physiology Practical Test in India Journal of Physiology and Pharmacology last year. So here feedback is given on time. If the student is doing mistake right now, give them feedback right now. Look here, it is difficult at basic science department. Somehow it is really we can give at during the clinical department, mainly to the postgraduate student during their round as well as during their operation procedure. But it is difficult in basic science department. So look here, to overcome the issue, MCI has introduced the logbook or certification of the competencies. At least we can certify few competency by giving them feedback. So here feedback is given on time and here feedback is given in wall. So here ideally we have to give the personalized feedback. Call your student in your room and give them feedback or make one or take one corner of full practical lab and then give the feedback rather than the mass knowledge transfer. Okay, ideally in lecture, what we do, we can give the lecture to the 150 student. This is the mass knowledge transfer. But when we are giving the feedback to the one student in one closed environment or the closed room, it will be constructive. Otherwise, feedback is not always constructive. Your feedback also damages brain of your student. So here ideally we have to give the feedback in closed room in a proper way by the proper way of communication. So the communication is one of the best tool to give feedback. So here timely given feedback face-to-face feedback in a very well manner to the postgraduate student during the clinical round. As we are faculties of the physiology, we have so many difficulties to give the feedback. But in clinical setting, they are taking their round every day. Every morning they have round. So they can give their feedback during their round. Even they can call students to their room and they can give feedback to students. Another thing, we have to give the positive feedback. And if feedback is given in a positive manner, there will be immediate construction occur or reconstruction occur during the surgical program or any type of the surgical clerkship, as well as during clinical round, as well as in basic science education. If we give the positive feedback in a proper way, on time, immediately, in a closed room, closed environment, definitely it will give us the result. So here you can cite the author's name. So here, look here, surgeons are doing the operation, student is assisting the operation. So in this way, student is learning, mistake is corrected on time. So your direct and positive feedback is valuable. If you are not giving the direct feedback, if you are talking too much irrelevant thing and by bad way, or if you are giving the negative feedback, it is not valuable. Look at why I'm talking these things, because so many teachers, they are giving the negative feedback, and negative feedback is responsible for the depression in the students as well as for the failures of the student. This is must in case of the postgraduate learning. So here, that's why I can say here there are two type of the feedback, positive as well as negative feedback. So here, is there any negative effect of feedback? I can say yes, there is a negative effect of the feedback, because there are two type of the feedback, positive feedback as well as negative feedback. I heard from the so many students regarding junior faculties, they bombard, bark at the students that you don't know, तुमको तो इतना भी नहीं आता है. Students are doing these things. So this is the negative feedback, and in front of the whole class, तुम्हें इतना भी नहीं आता है. And this is really very wrong thing. This is the one of the best example of the negative feedback. Here we have to give him the positive feedback. Call the student to your room and explain him. Beta तुम्हें ये नहीं आता है, you can explain in a proper way. Give them the positive things. So here positive feedback increasing people's confidence that they are able to pursue their goals, leading people to expect their successful goal attainment. And in contrast, the negative feedback undermines the people confidence and their ability to pursue the goal and their expectation of the success. So a positive feedback is always constructive and negative feedback is destructive. So here negative negative feedback, here we have to overcome from the negative feedback as well as we have to give the rather than negative things. So here change, or we are giving to feedback for the improvement, not to make the person negative. So here we are going to give them feedback negative to make the positive for the improvement. So here there are 10 steps of the feedback. You yourself time to control your emotions. So here ideally we have to give the feedback by the proper way of the communications. So here we have to deal with the emotions. We can give feedback on time, that is right now, do it face to face, do it in private, make the checklist to avoid the venting. So here avoid some bad words. So give the recipient a chance to speak, discuss the work, not the individual. Look at this is the key thing, okay? We have to always focus on the competency at our physiology level, not the individual, not the student. Okay, always we have to talk about the competency, and always our feedback will be on the correction of the mistake. Correction of mistake related to the competencies. We have to solve the specific problems, and we have to give the problem based solution, and always establish a one particular plan to move forward direction. Always in our life as well as at any circumstances, always we have to think about the forward, and always we have to end the feedback with the proper encouragement. So here there are the various feedback models. So here first one is the sandwich feedback model. So here we have to give the how to correct the mistakes. So here we can give positive feedback, then negative feedback, and at the end the positive feedback. So here this is the one type of the sandwich model of the feedback. So always we have to talk about the some good thing of our student, and during that time we can also try to correct his or her mistakes, and at the end positive things. Then the eco model of the feedback, you have to give feedback emotionally and on the basis of the content for the better outcome. So here there are three models: emotions. So that means by the proper way of the communications, we are going to deliver the content for the one of the best outcome. So here during my presentation, we learned that communication skill is the key step for the positive outcome of the feedback. That's why Medical Council of India, MCI, has introduced the ATCOM module. So your communication is the key steps in competency-based medical education, CBME. Thank you for listening me as well as for giving me the feedback. You can give me the feedback in our WhatsApp group. Thank you.
Thank you very much, Dr. Hasmukh. There are a few questions also. So meanwhile, Subhada madam can answer all the queries. You can just go through the questions in the WhatsApp group and chat box. So once
Chat
the
box,
Gada madam is over,
yeah, I have answered all the questions in the chat box.
but ma'am, please reply few of the question
In WhatsApp group,
a large
just
group
I'm,
also.
yeah,
In a large
sure.
group also, so everybody can benefit out of it.
Yes, of course, of course.
And meanwhile, Dr. Hasmukh can go through the questions, and once your questions are finished, Dr. Hasmukh can take over.
There is one, just now I saw one question on the WhatsApp. If all the systems, like the distribution of hours for teaching the respiratory thorax in anatomy and for teaching physiology of respiratory system in physiology is different. Yes, agreed. They are different. Now see, in alignment, it is not necessary. Like today anatomy people have teached, say, ribs and vertebra. So next day or maybe on the same day, I am teaching the mechanics of respiration. It cannot be on a day-to-day basis. Please remember, alignment cannot be on a day-to-day basis, but it should happen somewhere nearby. That is the purpose of alignment. Okay, simultaneously the two systems should go on in the two departments. Okay, थोड़ा इधर उधर तो होना ही है. It's not possible कि today they have done dissection of lung and I'm teaching them, say, diffusion or ventilation. Not possible. That much of it, alignment is not possible, but at least it should be somewhere nearby. Initially what used to happen, I told you, we used to teach them respiratory system in the month of, say, October, and they used to do dissection of the thorax in the month of February and March. Total dissociation. That has to be minimized. That is the purpose of alignment.
Few questions regarding how to handle a timing, because a few departments are taking 2 hour or 3 hour, and other department is taking 1 hour. So how to take care of it?
That is what I said. Naturally, anatomy people, they are devoted, or they are being given more teaching hours than physiology and biochemistry. Okay, so it's all a question of understanding. There is nothing rigid in this. Okay, MCI, as far as implementation of anything, whether it is SDL, EC, alignment, exactly how it is to be done on the floor, that has to be decided by involving multiple teachers. That is why I said multiple teachers are required. All the teachers of all the departments, they are required to sit together, and they have to dissolve their egos. They have to left it out. Without ego, like as somebody has mentioned, it is very difficult to sit with anatomy people. And I shared my experience also for the same reason. It's very difficult to change the rigid mindset of different people, because since ages this has been going on, and you are asking them to change. So naturally, it's going to take time. Okay, take the help of motivated people, and in every college there is a curriculum committee. You can, it's a curriculum committee, it's a MCI requirement. So one can take the help of curriculum committee because it is being chaired by the head of the institution ultimately. So you can take help of that, and ultimately it is up to us how to do it, how to take help of cooperative people from different departments. Suppose there are 10 people in anatomy, at least one or two of them can be ready to be with us. So take help of such people who are intrinsically motivated, and especially MEU people, they are of help. So take the help of these people, set few examples in the beginning so that the things will fall in line.
Ma'am. Secondly, one more thing, please explain redundancy. And
Yeah,
you have very
redundancy.
well
Yeah.
explained
Huh.
regarding the role of faculty during this
Hmm.
integration and
Hmm. Yeah.
nesting and all that. But
Hmm.
can you just reinforce on role of faculty of other department? For example, if I am
Hmm.
taking example of jaundice, do I need to invite physician or not? You have already covered, but just I want to say that you reinforce the
Yeah.
same thing again.
Yeah, the
So this
MCI
is
has very clearly mentioned, Chinmay, and the question is asked by, I can't see the name of the teacher, but the MCI has very clearly said that teachers of the other departments are to be involved in planning the lesson, or in designing the case, or in knowing with which learning objectives are common between the two departments. Their role is up to this. Okay, and actually MCI has tried to minimize our work. Otherwise, every time we will call a teacher from other department, he will have to find a time for us, he will have to prepare. And generally, up till now also we were doing the same thing. Okay, whenever we used to teach normal things to our students, normal things from any system, any organ, we used to teach them a little bit of applied aspect. Now, the same thing is being covered under the title or under the heading of either ECE. Sometimes we call it nesting, sometimes we call it sharing. Okay, same things, but only thing is it's coming under the different heading. And as far as the teachers of the other department are concerned, we are very clear on that. As far as possible, don't invite the teacher of other departments. They should be involved only in lesson planning or initial few meetings. But if the topic is difficult, like I gave you an example of audiometry. Suppose we are teaching them deafness in our lecture series on ear, we are teaching them deafness, then naturally audiometry is not our job. So if we can invite a person from ENT department who can teach, definitely he or she will teach audiometry better than us. So in such situations, definitely you can involve, but as far as possible should not be done. Again, it is fluidic, it is not rigid. MCI has just given us suggestions. Implementation is up to us always.
okay, ma'am. Thank you very much. Now,
Yeah.
question to Dr. Hasmukh sir. That as we have around 250 faculties, sorry, 250 students. If you have 250 faculty, then we will be more than happy. 250 students, how to give feedback to each and every person, and we don't have much free time except lunch time. So can you please guide us in that manner, Dr. Hasmukh sir?
Uh, Look, Chinmay, it is my project of the advanced course, and during the advanced course project, okay. So here during the somehow difficult during lecture to give the feedback. During lecture, it is really very difficult to give feedback on each topic, because at the time of the lecture we are not knowing what are the students are thinking about their mistakes. But during the practical classroom, if you are doing any things not in a proper way, okay, suppose any practical of the hematology or clinical practical, if they are not doing in a proper way or what we want, we can give them feedback to look at each and every students. I heard these words so many times that we do not have time, we do not have time. But I can say we have time. We have time. We have to utilize the time. Though we have 250 students, but in practical 250 students are not coming at one time. Only we have 50 students are coming as per my knowledge, okay? Or ideally we have to think about 150 students. So here 50 students are coming at one time, and 50 students can be addressed by 3 or 4 faculties at least. minimum 2 faculties we need. And if students are doing, we can regularly watch. Here ideally we can use the camera. For that purpose we install camera in our lab, and we can check these things and we can correct. And few things, the checklist is must. If you are making the proper checklist and ask the student thing in their own way, and one thing, this is the passive thing, okay, or indirect thing, and directly we are going to table wise to each and every student and give them 5 minutes, 5 to 10 minutes. We check their points, skills, and we try to correct at that time. This is the one thing we can do. Second thing, we can do this thing during revision. Third thing, we can do the same thing during the formative practical test. Now, any other queries? We can do these things. Okay, we have done the same thing at Pramukh Swami Medical College, Karamsar. We are doing these things. So it needs lots of dedication, hard work, and ideally you have to give your time. That is the main thing. But nothing is impossible.
Okay.
Chinmay, any question?
Yes, sir. No, thank you, sir. One more thing I would like to inform, or I would like to share, that we all are discussing in WhatsApp group and chat box regarding integration and alignment. Now, let me tell you, and those who have completed CISP 1 and CISP 2, they are knowing that there is something known as curricular governance, and under that, under MEU, there is a alignment and integration committee is to be formed for a first phase, second phase, third phase, and fourth phase.
Yes,
So
all phases.
ideally, yeah. So they will, with the leadership of MEU and Integration and Alignment Committee, will take care of alignment and integration. So if in your college, if it is not existing, you can just talk to MEU coordinator or a dean sir to have such committee. And yes, as we know that till date we have remained in the silos. My department, I am HOD, and that all have to put. Ideally, I have seen that we physiology people are very mild and we all are submissive, and we will see that with the help of MEU and integration committee, other HOD will also support us, and we can do together. So is there any questions? Anybody else? uh, Dr. Asmuk, question to you: what is the faculty strength at your college, sir?
At my college, we are only 7 or 8. We are only
Okay,
7 or 8. But we are doing. Look,
okay, okay.
there are problem. If you solve the problem, you have to think like the school teacher. The school teacher, they start their work in the morning and they come out at the end. But in the college, we have to give time. Suppose you have practical of 3 to 5 or 2 to 5. Give to at least 2 or 3 years. It is possible. At my college, we have students on Tuesday, Thursday, and Saturday during 2 to 5. And during that time, okay, we are all in. That is why everything is possible. If all you are in during practical as well as during ECE module, during case-based learning, during problem-based learning, then there will be no problem. But one thing is, as I told you earlier during my lecture, teamwork, and one thing, all are in. Okay, this is the one new principle for the CBME. If all faculties are in at one time, then everything will be possible.
Okay. Uh,
Can
yes,
I
I
tell
think
you
Sir,
one
there are.
thing?
Chinmay sir, I have
One thing,
question.
one thing,
Can
one
I
thing.
ask?
Chinmay,
Yes,
Yeah.
yeah,
Chinmay, can I tell you one thing?
yeah, yeah. Please, please.
Chinmay, I want to tell you one thing regarding the ECE and this CBME module. This year, there are some shortage of faculty. So we went to the anatomy department to help them during the ECE module as well as during CBL. During anatomy, ECE and CBL, we went to the anatomy department and we helped them. And in this way, we make the overall program successful. So not in physiology. If you
Great.
want to work in an integrated way, you can go to biochemistry, anatomy, and at the end, okay, if we see the Harden's linker, at the end, we can make the each competency, trans competency. And Shubha madam explained this very well.
Okay. Mathani
Any
madam
other
want to say
question?
something. No,
Yeah.
Mathanya madam, you want to ask something?
Yes, sir. First, both the speakers, it was a wonderful session. My question to Hashmukh, sir. Um, Sir, the want, will to do, every teacher has it. They want to do it in the best possible way, give it to their students. But some institutions, the same set of faculty handle not just MBBS or BDS, but at least 10 different programs. What's your advice to them? How do they stretch themselves apart from any other additional roles they are being given?
Okay, I want to tell you
And
the good
beyond the
answer.
scope, just wanted to handle, just a tip to handle.
Madam, look, I want to give you, look, we have FIBSc student, okay, medical technology. Listening me properly, yes or no?
Yes, yes, yes. Please go ahead.
Okay,
I'm
we have
listening. I've just muted myself.
medical technology student. They're coming for around 60 years teaching of medical technology student we have. Then 60-year teaching of the pharmacy student. We have 5-year course of the pharmacy student. We have physiotherapy student. But we, first of all, we have 150 student and we teach Tuesday, Thursday and Saturday exclusively for MBBS student. On that day, we do not take any student. And on Monday, Wednesday and Friday, we take the other courses. And these courses are coming only for 60, 30. We have also 6 or 7 courses. If at your department 6 faculties are there, you can do, okay? But for that, you have to make the proper schedule. And that is the main aim of the CBME. Ideally, we have to make the proper timetable for in alignment and integration. What is the first step? First step is the proper timetable. If we have proper timetable and then proper plan to execute. So here, this is the main function of our brain, motor planning. So here we have to execute this function. By proper planning, we can do these things.
Thank you,
And
sir. Thank you.
can I say, Hasmukh sir, planning academic
Yes.
calendar is a huge task. It's a huge task. It needs
Yes, yes.
manpower. You have to literally put your head into it, and it's time consuming. But then once you design it, it comes out beautifully. And can I suggest all of us, we can visit the website of different colleges to see their academic calendar. Some colleges, they have designed it beautifully, academic calendar. Karamsad Kabir sir.
Yes, yes.
I have heard very about very good things about the academic calendar of Pramukh Swami Medical College.
That's why, madam, I'm speaking this thing. Why it is
Yeah,
possible at
yeah,
Karamsad?
yeah. That's why.
Because
Any other
we are
question?
planning for the 5-year timetable.
Yeah, Bapre.
We have timeline of the 5-year. That's why it is possible.
Yeah. So you
But
need devoted
self-motivation
people.
is,
You intrinsically motivated teachers, and they should
yes,
be
that
able
is the
to
main thing.
motivate other. That's the main thing. That's the crux of
I
everything.
told
It settles on that.
previously that number of faculty matters, but motivation matters first.
Much more.
Much
Yeah.
more.
Yeah.
There is one question, or either it is in a sarcastic way that we as a student never got feedback, but we also did well. Then why so much importance is given to feedback now?
Look,
for betterment.
look, there are so many good doctors from the traditional curriculum, but CMM is implemented and introduced
Mhm.
by the medical educationist. Okay, so
Communication
here,
skills, Hasmukh sir.
yes. Look,
But we could have done better.
yes, yes, we can do better, but think about that in each and every batch, 5 to 10 students they are failing at last after so many exams. So look here, few things are good for the slow learner. The good learner is good in adult learning,
Hello.
self-learning, but weak student, they are not good. So few things, this is the mixed approach. Okay,
Okay.
this is
Yes,
the
Inamdar sir, you
mixed
want to say
approach.
something?
Inamdar sir
Yeah,
wants to speak.
yeah,
Yes,
yeah.
sir.
Uh, I'm Dr. Inamdar from MGM Medical College.
Sir, we know you very well.
It's an excellent presentation from Dr. Gade Madam and Dr. Hasmukh. I want to put forth some few points. One, uh, as Chinmay mentioned, there is an alignment integration committee which is functioning in our college. We have regular meetings, and for nesting, what we do is MCI has given that format as to which department, which topic you are going to call for.
Yes.
So we take the content from them in the form of 2-4 slides related to that topic. It is like an applied or clinical physiology from pathology or medicine, and then those slides are reviewed by our department to look at appropriately how much is to be incorporated. So getting the content from different departments and nesting into our lecture, that is one thing which is can be done. Number two, as mentioned by somebody, there are some universities in South, I'm forgetting the name, they have a block pattern, block. So they have a cardiovascular block, they have endocrine excretory block, and in that block, they have incorporated anatomy, physiology, biochemistry. So the administration puts them into a block and makes them to do a shared timetable. So that block system looks well to be incorporated, can be looked at. Another point about the reflection and feedback. So we have to separate what is reflection and we have to separate what is feedback. So reflection is what I learned and how I will do better. So self-awareness. So we have to have a separate kind of a discussion on reflection and separate it out. Feedback, there is a confusion. Like earlier, feedback was given by the students about the teachers, and the teachers resisted. But now it has been normally being taken for even for all these sessions and all. So feedback which is given by the recipients to the speaker or to the teacher. So this is separate one. This feedback we are talking about is what the teacher is giving to the students about his performance, his or her performance, so that on the performance. So the students have first to perform, and then there is an interaction, and to find out what are the gaps which could be improved and how it can be given in the best possible manner. One of the points that I want to stress is after formative examinations or even internal assessment examinations, terminals and prelims, there is a system in many colleges to take the students in small groups, give a general feedback about what should have been written, how they can score for these questions, and we can also have a one-to-one feedback about each student, because there are few students who come to us, sir इसमें क्या लिखना था, इसको मार्क कैसा कम गिरा वगैरह. So that is the correct way, correct time when they are very curious about their feedback, and this is one which we can incorporate in the system. Plus the feedback on the vivas can be given, on the practicals can be given. So these are few points about feedback and the integration. And in integration, there is always a confusion about what is this. One is linker and nesting. Nesting is an area of, I think we should get it more deep into it. Thank you.
Yes, Dr. Jayanti Mishra want to say, yes, Dr. Advani sir, you are also self-muted. You can unmute yourself and speak. Dr. Jayanti Mishra madam is also self-muted. You can unmute. Congratulations to both the speakers. I can see there is no more questions, and if there will be still questions are coming, it can be discussed in the WhatsApp group. So my humble request to all the participants that please attend session. If you have missed a session, please go through the recording. You have already got those who have joined Google Classroom. in a classroom assignment, today's assignment, please do it. I will share that also in a WhatsApp group. Okay, as well as request all the subgroups to start preparing their SLO. Write down the timing, which method you will use, where you will do integration, where you will do ECE, SDL, SDD. Start preparing it, because now only 15 days are left, and I know that we have revised the timetable, and within 3 days we will put the timetable of presentation by all the different groups. So please get ready, please work in the group. If required, do Google Meet or in a group, and please start preparing for the task. Okay. Anything to share, Dr. Asmuk and Dr. Sudhila Gade, ma'am?
No, sir.
Otherwise,
No,
we can
not
close the
yet.
session.
Yeah, please.
So, thank you very much.
Thank
Good
you
night.
so much.
Stay
Thank
safe.
you. Thank you.
Stay home. Thank you very much.